Hi, Dr. Adam Goldman of the Metropolitan Vein and Aesthetic Center. I wanted to talk to you today about Varithena treatments, how to prepare, what to expect, and the aftercare. So let's get started. If you've been diagnosed with venous insufficiency, you may have been recommended to have a Varithena treatment. It is often used to treat the superficial veins and the communications with the superficial veins to the underlying veins that may be causing the problem. It is important to do this for symptoms and to prevent recurrence of the disease. The preparation is fairly simple, just normal bathing. You should take all the medications that have been previously prescribed, including blood thinners. The risk of bleeding during the procedure is minimal, and if you have been recommended to take blood thinners, it's very important to continue that medication. Once you've arrived at the clinic and you're brought into the room, the next step is to have you stand for several minutes. What we want is gravity to actually fill these veins with blood so we may see exactly what we need to treat. These veins are then marked, and then after that, you'll be placed on the table so we can check with ultrasound, we can map the veins and see exactly where the communications are, where the branches are, and what exactly needs to be treated. The next step is then to access the veins. So the first step in that process is to numb the skin. We use a very small needle, 30 gauge needle. You'll feel perhaps a pinch or described as a mosquito bite. After you are numb, then we can admit more anesthesia through a larger needle, and that same needle is then used to access the vein. Sometimes you feel a little pinch as we get close to the vein because there's a limit to how much we can put in under the vein. It may compress it, so make it difficult to access. So sometimes you feel a little pinch, but once we're inside the vein, there is no symptoms. This process may be repeated several times as there may be branch points, other chains of veins. So it may take a few minutes to get all the access in. Once that's done, the next step is to actually drain the veins to make them as small as possible. And this is done by putting you in what's called a reverse Trendelenburg position. So basically it's the legs up and the head down. The treatment beds are designed to do that, and sometimes we'll also use a wedge or additional pillows to get additional elevation. This is a very important step, and you will be left in that position from 1 to 15 minutes. And obviously we take great care to make sure that you're comfortable and use any additional padding that's needed, or need to shorten the time in order to start earlier if you're having a lot of discomfort. The next step is to inject the Varithena. That is due through the prior access points, and you may feel a little bit of burning, but in general it's not very uncomfortable. And we then monitor the progress of the Varithena procedure with the ultrasound to make sure the veins are closed and that all the treated areas are complete. The next step is we remove all the access points, and very important, we then put a compression stocking over the leg to help press on the veins that we've just closed. And sometimes we also put a second layer of compression with an ACE bandage and a tubular foam or pressure bandage. So it's very important that this is then left on the next day and that night. So when you come off the table, you're going to wear those 2 layers or a single layer of compression that day and sleep with it. And the next morning, if it's actually a 2-layer of compression, we actually ask that you do not take it off. If you need to bathe, you will then cover it with a plastic bag or use a sponge bath or use a baby wipe. But it's important to leave it on the next day and the next night, and then the following morning you take it off to shower normally. If it is a single layer of compression, you can actually take it off the next morning, shower briefly, and then put it back on for an additional day, additional night, and the next morning again, take it off to shower. We then ask you to wear the compression stocking for several more days, anywhere from 1 to 5 days. But at that point, you can wear it during the day and you don't need to sleep with it anymore. You need to avoid sweaty exercise for the first 3 days, as well as bathing or sitting in a bathtub or swimming. After 3 days, there are no restrictions. You may have some mild pain or bruising. You can take Tylenol, Advil, Motrin, aspirin, whatever you have in the house for the pain. You could also mix acetaminophen or Tylenol with the non-steroidals, which is aspirin or Motrin if you need additional relief, and those will work together very nicely. So the other important thing to pay attention to is you may feel some discomfort. You may feel a little hardness on the skin. That's actually the vein that has been closed, and that may take quite a while to dissipate. However, if a few days later, or anytime, even sometimes a week or two, or even 3 weeks later, you feel a lot more pain, it may be that blood has become trapped, coagulated blood has been trapped inside those veins that we have closed. So it's important that we remove that, because the iron in those veins can cause a prolonged state of inflammation, a lot of discomfort, and secondly, it can actually cause some discoloration of the skin over the vein. So if you're feeling a lot of discomfort, it's important that you follow up with us, and then we can check with an ultrasound, and if needed, do a drainage procedure. This is done with local anesthesia, and after that, you'll feel quite a bit of relief of your symptoms, and the healing process will be much better. It may take a few weeks for your symptoms to resolve. As I said before, you may feel a little bit of a nodularity of the skin. That's actually the vein, but eventually that will be reabsorbed by the body, and you will be back to normal and hopefully feeling much better. So if you're experiencing symptoms of venous insufficiency, such as cramping, pain, swelling, please feel free to make an appointment with us at the Metropolitan Vein Aesthetic Center. We've been treating venous insufficiency for 15 years, both new and recurrent disease, and we would love to have the opportunity to treat and hopefully make you feel and look better.